My name is Malvin Laroya.
I'm Sherlyn Toledo, and our presentation is on CBD health medication. Topics I was able to cover were what can CBD be used for, what are some side effects of CBD, and what are CBD's impact on society.
And the topics I'll be covering is the introduction to CBD, the history of CBD, facts about CBD, and also the future development in CBD research. So first, let's cover the introduction to CBD. What is CBD? The cannabis plant contains a chemical component called cannabidiol or CBD. CBD does not provide a high in contrast to THC. Why is CBD popular in health treatments? It draws attention since it may have medical benefits without THC's mind-altering negative effects. It's used in a variety of ways, including foods, oils, tinctures, pills, and lotions. The history of CBD. Its ancient use. Since ancient China, Egypt, and India, cannabis has been used medically for thousands of years. In its modern research, Doctor Roger Adams of the University of Illinois isolated CBD for the first time in the 1940s. In 2018, a CBD-based medication called Epidiolex was authorized by the US FDA to treat uncommon types of epilepsy. Legalization and growth. The 2018 Farm Bill made hemp-derived CBD legal in the US, encouraging research and broad distribution. The facts about CBD. It's non-intoxicating. Unlike THC, CBD does not produce a high. It's legal in most US states. CBD is lawful in many states as long as its THC content is less than 0.3%. It's not addictive. Compared to other drugs like opioids, CBD has a reduced risk of addiction. Many uses. It may be used for a variety of conditions, including pain, anxiety, and sleep. Global use. CBD products are sold all over the world, including in Europe, Asia, and the United States. The future development in CBD research. Increased clinical trials. More studies are needed to confirm CBD's efficiency in treating ailments including anxiety, chronic pain, and PTSD. It's personalized medicine. Tailored CBD therapies based on personal health profiles or genetics may be developed in the future. Innovative delivery techniques. Transdermal patches, inhalers, and more potent consumables are examples of new formulations. Expanded legalizations. Growing research may lead to more widespread legalization and more CBD globally.
What can CBD be used for? Like mentioned before, CBD is a non-psychoactive compound found in the cannabis plant, also known as weed or marijuana. It can be used to treat rare forms of epilepsy, and it has an FDA-approved drug called Epidiolex, which is mainly used in children from the research I've seen. It can be used to treat chronic pain and neuropathic pain, as it regulates pain and inflammation. It can be used to treat both anxiety and depression. It can be used to treat insomnia, as it's a relaxing type of medicine. It can be used to treat skin conditions like eczema and psoriasis. But like my partner said, it's enough for a person to feel relaxed, but not high as a person would if they were smoking weed. Side effects or symptoms of CBD include drowsiness and fatigue, gastrointestinal issues like indigestion, diarrhea, or bloatedness, a dry mouth, or changes in mood. But like every other medication, of course, CBD is going to have its side effects. These are the most common side effects of CBD, but more serious side effects of CBD include liver damage, drug interaction, low blood pressure, and potential reproductive effects, which affects both male and females. For females, CBD can affect their ovulation cycle and menstrual cycle, while for males, CBD can affect their sperm count And then going back to drug interaction, that is a rare occurrence. It really only occurs when someone takes CBD while already having some type of prescribed medication in their body, which can lead to really more intense symptoms than what you would normally have. CBD's impact on society. Public health wise, people use CBD as an alternative to treat their symptoms like anxiety or pain because CBD is more affordable and it's really easy to find as it can be over-counter medicine instead of prescribed medicine, which sometimes can be a little pricey. It also reduces the stigma against cannabis products. Um, Economic wise, the CBD market continues growing and it's generating billions and billions of dollars as of 2024 alone. Um, there's also a boost in agriculture with legal hemp farming expanding after its legalization in 2018. Um, CBD's impact on society, social wise, like I said before, the normalization of cannabis. It can be found in stores like your local grocery store or maybe a liquor store. It can be found in gyms and spas and can be used as a form of treatment or can be used like during a massage or something. Scientific wise, CBD's benefits are is really good and is generating more research interest into cannabinoids. So more people are putting money into finding out more benefits of CBD.
In conclusion, CBD has emerged as a promising alternative therapy with a growing body of research supporting its potential health benefits. From its ancient use in traditional medicine to its modern day applications in treating chronic pain, anxiety, and sleeping disorders, CBD continues to evolve as a viable treatment option. The 2018 U.S. Farm Bill and subsequent approval of CBD-based medications like Epidiolex have played a crucial role in expanding the legal and scientific landscape surrounding CBD.
CBD continues to leave an impact on the world. It's still being used all over, and as it continues to grow, more information about CBD should be known. There should be way more funding to understand the effects and benefits of CBD, with more evidence and research to support it. We could be looking at CBD playing a bigger and more prominent role in the healthcare world. Now, before we continue, to my partner, what are your like real opinions on CBD?
My real opinion on CBD overall is that I feel like CBD's purpose is good for you because it's used in medicines for when you're hurt or sick or when you got a wound. So like it could go from your health benefits, but also it could go to your hygiene because they make CBD out of lotions, soaps, or anything like that. And for anyone who ever says like they get addicted to CBD, I feel like that would just be them like abusing it with anything, like because like it some things could be good or bad depending how you use it. But overall, the purpose of CBD being here is for a good reason. Is to help us for our health, hygiene, and also when we're hurt or sick overall. And what are your thoughts on CBD?
I think CBD is great. Like you said, it's found in a lot of things. It can be found really easily in stores. When I was doing my research, I really liked reading about how affordable it was and how it's like an alternative instead of paying like for a pricey medication. I think it's really nice. And if we go back to the what can it be used for, I think this is a pretty good list. Um, like epilepsy, the Epidiolex is it's the first time I'm hearing about it. I didn't even know CBD had a part in it. I think that was really nice. And anxiety and depression. I also just learned about how it can help that, and I thought that was really cool to see. So I think it is beneficial. And like you said, when it comes to like people saying they get addicted to it, I think that's kind of their fault. I mean, I'm sure there's a lot of like warnings and stuff on it, which people should be able to read and do stuff on it. So I think it's a very beneficial drug, and
Mm.
I mean, from what I'm seeing, it looks like it will play a more prominent and bigger role in the healthcare world. And then moving on to our reference pages, this is mine and my partner's references that we got from doing research. This is what we use for our slides, and for our personal paper, we gathered information from educational websites and so on. Thank you for watching our presentation.